several changes have been made to the adjusted alert level 1 of COVID-19 regulations. Going forward, those who test positive but are asymptomatic will not have to isolate. Yes, you heard right. And for those who test positive and have symptoms, well, you'll now have to isolate for 7 days instead of 10. Let's unpack the changes with Professor Mosa Moshabela, Deputy Vice-Chancellor of Research and Innovation at UKZN. Prof, thanks so much for your time and congratulations again on your full-time appointment to this position. We wish you well, eNCA.
Thank you very much. Greetings, Shahan, and to the viewers. Thank you.
All right, so let's talk about this because I've had so many people message me and discussions in this newsroom about people who are asymptomatic but positive not having to isolate. The reason there's concern around this is because at first we were told that people who are asymptomatic are actually spreading the virus as well. So what's changed?
Yeah, and I think there's a number of levels of the changes, Shahan. Let me try and first acknowledge that, yes, indeed, it should be a concern for the public to receive such a policy statement. And also, I think it is true that people who are asymptomatic can still transmit infection, even though we will also know that they will generally transmit less than people who are symptomatic. So people who are sneezing and coughing will transmit more than those who are asymptomatic. So that is the first thing. That has not changed. And I think the most important thing that has driven these changes in the regulation is the fact that in the program that was implemented to essentially implement isolation, especially from the side of the government, and quarantine, we did not get the benefit that we expected for the money that was invested. So firstly, the issue is the cost. The cost of quarantine and isolation was too high compared to the benefit. I think that that is a good decision in terms of the savings that government can make from that point of view, from a cost point of view. The second thing to note is that given the fact that a lot of people are vaccinated and quite a number of people developed immunity from infection, especially when we faced the Omicron wave, then we saw that in the workforce, there was a lot of people who ended up having to be at home while they were asymptomatic or be at home while they had mild disease. And a lot of people who were exposed ended up having to quarantine at home. So this essentially depleted the workforce. And we saw it especially in the healthcare sector during the fourth wave. So the policy, Shahan, is a reaction to these things. And it's justified, of course, given the fact that, you know, medically, biomedically, there is high levels of immunity for now. And also the kind of immunity, the cellular immunity, that can protect people from severe disease. A part of it is then that, you know, we don't get a lot of benefit by reducing or preventing the infections that are coming from people who are asymptomatic. And that's why there's a shift towards what they call a containment strategy, which is used to prevent the spread of infection versus a mitigation strategy, really kind of dealing with sort of a crisis or clusters of outbreaks and things like that. Yeah. But I can say now that this is not good news for people who do not have immunity against COVID-19 or and
that's the concern, right? Because you first said it was a concern and then you try to justify government's decision based on immunity and cost-saving measures, etc. The reality is, if you test positive and you're asymptomatic and you go to the office and you sit next to someone who has comorbidities, the chances of them getting the virus again and their lives being put at risk again is very high. So is it the right decision and should it be relooked at?
Yeah, so I think from the perspective of managing the workforce, it makes complete sense to me. And I think that it is the right decision in this regard, especially because we can afford to reduce the number of days for isolation, given the recent experiences we've had with COVID and the levels of immunity. And Shahan, that is not necessarily to justify the the decision of the government that is supported by the recommendations of the MAC to government. The area where there is a problem, which I completely agree with, is in terms of how this is communicated to the general public. The messages that are in those recommendations do not necessarily align well with the sort of messages that should actually be going out to the general public. And for me, that's the area where I think government has to provide more clarity.
And just
in the workplace, makes sense, but for the general public, there are discrepancies that I think have to be clarified.
Yeah, just in terms of immunity, because that's one of the reasons being used now as to why we can do this. How long does immunity last, especially when you get infected?
Yeah. So I think there's two parts of the immunity. Previously, whenever we spoke about immunity, we would often talk about the antibodies, and we say that the antibodies will wane. But I think we've learned from the fourth wave also that we've got more durable T-cell immunity. And the T-cell immunity is the one that protects from severe disease and from sort of death as well. But it does not necessarily prevent infection. It's like your second line of prevention. And a lot of people who are essentially supporting these changes that are being made are actually also adopting a position that says there's no need to stop preventing transmission of disease. Personally, I think that there's no need to try for government to try and use sort of large interventions to try and prevent transmission of disease. But I still think that there's a need for individuals to practice measures that can help them to prevent the spread of disease. That, for me, that's the part that I think is lacking. And my criticism of this discussion has been that, yes, it makes sense if you look at the message from the point of the health system. It makes sense when you look at it from the point of the health workforce. But we are not necessarily adopting an approach that centers the perspective of the general public. And that's where my issue is, because from the perspective of the general public, there's still a need for continuation of measures for individuals to be protected, not necessarily the general population perspective that is being adopted now in terms of a perspective looking at it from the point of the health system. I hope that makes sense to you.
Yes, it does. Thank you so much for your time and your insight. Always a pleasure. Professor Mosa Moshabela, Deputy Vice-Chancellor of Research and Innovation at UKZN.